Could you please share just kind of your introduction and a little bit about your background?
Yes, so I am a GYN surgeon. I'm here in Northern California. My primary area of training, or I guess you want to say of specialty work, is robotics. I completed an AAGL fellowship out of Virginia Mason in Seattle.
Great, thanks for that. And could you share just how you got into coaching? What was your introduction? How did you find coaching?
Yeah, so I got into coaching after honestly having one of the most undesired experiences in the OR in early 2022. Patient did fine, but her surgeon did not do
Mm.
fine. And the experience actually bothered me so much so that I reached out to my program director and I asked her, I said, "Am I a safe surgeon? Did you launch me from fellowship too
Mm.
soon?" And after she reassured me that yes, I was a safe surgeon and that I was, going to be fine, she recommended that I get a surgery coach. And, like most people, when we're looking for things, I went to Google and I searched for surgical coaching, and the academy popped up, and that was the beginning of my journey.
Fantastic. And then not only did you go through coaching yourself, you also then became a coach. Could you talk about your
Yes.
decision to do that?
Yes. So I decided to become a coach because the impact that coaching had on me was so profound that I realized it truly changed how I engaged with others. When colleagues would come to me, ask me questions, ask me for my assistance, I found that I was going back to some of the techniques that I had
Mm.
picked up on during my surgical coaching. And that kind of prompted me to want to become a coach myself.
Wow, that's fantastic. And then why bring it to your surgery department? What made you decide this is something our department needs?
Well, after my own experience, and again, this is the person who's coming with 3 years of surgical fellowship training and 4 years of OBGYN residency. I'm like, if I can leave the operating room feeling like that one day, I can't be alone in this. And
Mm-hmm.
so, really just looking at where we were, not just as an institution and as a department, but where we are in healthcare, whether it was the impact of COVID or the change in the work hour restrictions. Unfortunately, surgeons are not coming out of their training with a a full complete refinement of the skills that they need to really do this job. And patients are becoming more and more complex surgically, and you're going to have those days where things are not going to go as you plan. And how do you recover from that? So that's why I wanted to bring it to our department as a way that maybe we can begin to kind of help become a part of the solution.
Thanks for sharing that. Could you talk about what the program is that you're instituting?
Yeah, so we have identified surgeons and not just surgeons, but I guess you want to say physicians who have expressed interest in becoming surgical coaches. And we are partnering them with other surgeons and participants who have expressed interest in receiving coaching. And so by taking our coaches through the certified training program through the academy, they now have the formal training to actually help those who have expressed interest in receiving a coach.
And so, for those that are participating in the program, both on the coach side and on the coachee side, what kind of reasons are you hearing from them as to why they want to be involved in this program?
Yeah, so for our coaches, they have expressed interest. For some, they honestly see this as a way to help really retain some of those physicians and those surgeons that are kind of in
Mm.
mid-career where they can either make a decision to, leave medicine and go do, real estate or do something else, right? Versus staying in medicine. For others, they realize, gosh, this is a great way to incorporate, or great tool to incorporate into our medical education process and training of future physicians and residents. For some, they're very candid that they were one day, thinking about leaving medicine, ready to retire. So listening to podcasts on life as a retired physician,
Mm.
and maybe someone mentioned coaching. And so then they go down the pathway of looking into coaching, and so now they're excited about staying, and others just want to give back. Maybe they're not in the operating room, but they still have a lot of knowledge to share, and so
Sure.
they're just looking for ways that they can continue to contribute to the development of surgeons. As far as our actual participants go, they are reaching out because they're like, hey, I need something, right? These are normally, and for some of these providers, they're either new to our group and our practice situation is different from what they've previously experienced, or others, this is their first job right out of residency and training. And after a year or so in, they're like, gosh, I need something to just help me, get over this hump. And so they're reaching out with the hopes that this is going to make a difference in their career.
Great. That's really great. So how did you prepare for this? What did you have to get ready to take to your institution for them to say okay?
Yeah. Well, I really had to take the data that I had. So,
Mm,
and I just had to prove to them the validity of this process because, coaching is one of those things that sometimes it can be very challenging to explain. You just have to experience it. And so, for the individuals who are really sitting down trying to figure out, okay, is this something that we want to invest in? What are we going to get? What is our return on investment? I had to present them with the data that showed the return on the investment that they are getting because I hired my own surgical coach. And so there was working with our analysts saying, hey, please pull my case data for all my hysterectomies the 6 months prior to me doing coaching while I was coaching and then 6 months after. And, they were able to see, wow, although the complexity of, my cases is increasing, my time in the operating room is decreasing. How did you gain that efficiency? And that gave me an opportunity to really, give a plug and for the program. A lot of meetings with people, and I will admit I was able to do this under the umbrella of our leadership development academy that we have here. And so it really got me in front of the people who would really help me carry this forward. But if you don't have that opportunity, let's say that you don't have a leadership academy to really work through, I would say take advantage of the data that you have and go and find what I like to call those key shareholders, those people who are going to be impacted as a result of your OR becoming more efficient, as a result of your physicians having less burnout, physicians having more joy, happiness, and meaning when they come to work. Find those people who are going to benefit from that and see the need from that. And that's where you want to start because they're going to be the ones that are going to help you move this along in your institution.
that makes a lot of sense. Makes a lot of
Yeah.
sense. Any particular barriers that you ran into in this process of trying to get the program approved?
I would say one of the biggest barriers, other than the ones that I've already kind of mentioned, was truly just finding the time.
Mm,
So protecting people's time because we all have the same amount of time and there's so many things that are just really kind of vying for our attention. And so what I ultimately ended up doing after working with some of the other people that had expressed interest in this was we just looked at our schedules and we said, where do we have time for this to happen that will not impact access to patient appointments? And so, like most institutions, we have department meetings, and we looked at the amount of time that's blocked off each month for a department meeting and basically went to our department leadership and said, can you give us that first hour? Can
mm.
you give our coaches and our participants that first hour to meet during the department meeting so that their coaching sessions can be protected? We don't have to worry about them being impacted by, patient care that's running over or anyone that's going to be in the OR or call schedules, et cetera. And that's what we asked for. And I feel like that was really key because now that our leaders know, okay, bringing this program in will not necessarily impact our ability to get patients in because as I'm sure people are aware and at their institution we're in a time where we're being asked to do more with less. And
Right.
so it was just a very creative way for us to use some of the time that we already have blocked off.
I think you address one of the things we hear kind of over and over, right? This is the common issue, finding the time. People are
Yep.
interested in finding the time. So creating a protected time is a really smart approach. So thanks so much for sharing that. Any final thoughts? Anything else you would share with folks that were thinking about bringing coaching to their institution?
I would say if you're on the fence, maybe go through the process yourself.
Mm,
Once you go through that process yourself, and you've had the opportunity to have a coach, you will understand how this can be beneficial to not only your department, but truly for the field of medicine and the communities that we work and practice in. I always tell people at some point in time, all of us as physicians are going to become consumers of the product that we are currently, sharing, right? Currently selling.
Sure.
And this is a way that we can make sure that those who are taking care of us have the right tools and that they have what they need so that they can take care of us and take care of our families well.
Great insights. Jessica, thanks so much for sharing your background, sharing how you're approaching this program, and really appreciate you being with us.
Wonderful. Thank you all.